IMbark is a very important phase II trial that was done of Imetelstat, which is a telomerase inhibitor already approved for myelodysplastic syndromes with lower risk disease and anemia, which is being investigated in myelofibrosis. In fact, they have completed accrual to a large phase III study called the IMpactMF trial, which has overall survival as its primary endpoint. These are patients who have failed JAK inhibitor therapy. However, what we are discussing today is IMbark, which is a phase II already published, and this looked at two different doses of imetelstat. One was the 9.4, which is believed to be the active dose, milligram per kilogram every 3 weeks IV. The other was the half of it, 4.7. Now, we already know from what's been published from IMbark that there was an apparent survival benefit for the patients who got the 9.4, the higher dose. Their median survival, and remember this is JAK inhibitor failure, so both IMbark and IMpactMF are in the second line JAK inhibitor exposed failed setting. Now, given that, the median survival of about 28 months was about double of what has historically been reported, about 13 to 14 months in this setting. Now, what this poster adds at this ASH meeting is that it really correlates some cytokines which we well recognize as being pathophysiologically important in myelofibrosis, like IL-8, TNF-alpha. It shows us the downregulation of these cytokines. We already knew that imetelstat is able to improve bone marrow fibrosis and reduce the driver mutation allele burden, but it's new, this data is new, showing that it can reduce these important cytokine levels, IL-8, TNF-alpha, and that had a correlation to that survival benefit that I just mentioned.